Brittany from Atlas here, and today I want to talk to you about numbness and tingling and what they mean and what you should do about them. Numbness and tingling can happen mostly in our extremities. Things like our fingers can go numb, or our feet can go numb, or we can get kind of a numb feeling in our leg or in our arm. Those are really common places to get it. It's less common to have like on the spine or on the body, the torso itself. And what numbness and or tingling mean is that a nerve is being compressed or being not given enough circulation. So it's not getting enough blood circulation, or it's just being compressed. So they're kind of two different things. There's circulation, lack of circulation, especially if you're someone who has really cold fingers or Raynaud's phenomenon, something like that. You may just have numbness and tingling in your fingers from lack of circulation, or you can have a compressed nerve, which most often when someone comes in to see us, the culprit is usually the compressed nerve. And that's things like, really common is sciatica. So what happens is you get a pinched nerve up in your back or in your hip, and then it sends numbness and tingling down from there, into the leg, into the foot, things like that. So what causes this most of the time is a compression usually at the spine. It can happen at other places, but a lot of the time it's at the spine. And that can be from degeneration of a joint. That can be from a chronic malalignment of your joint that just puts compression on the nerve. And then what happens is when that compression happens long enough, your nerve starts to show those symptoms of tingling and numbness down into the extremity that it serves. So often when we talk to people who have numbness and tingling, we want to know exactly where you feel it. Is it the pinky finger? Is it the ring finger? Is it the thumb? Because the certain nerves go into certain areas, and certain nerve roots from your spine will show the symptoms in particular places. If your big toe is numb, that's different than if your little toe is numb. And from there, we then try to trace back through that nerve's line to see where the compression is coming from. Now, I will say that if you have numbness and tingling on a continuous basis, a couple times a week or every day, you really should get that looked at as soon as possible. Numbness and tingling means, again, your nerve is getting compression. And in really long-term cases of someone having that for a year or more and not doing anything about it, it can end up causing actual permanent damage when you do finally get it addressed. The longer something is there, like numbness and tingling, the less likely it is to just go back to normal, and the longer it will take. So slower healing happens when you leave it for longer periods of time. So if you do wake up or have any numbness or tingling in any part throughout your day, I would recommend going to get it looked at right away. Often there are easy things you can do when it's not been very long, and leaving it longer makes it harder to get rid of. So you might as well go get it looked at, find out what the source of it is, and then be able to adjust from there and see what you need to do next. Okay, I hope that helps you understand your numbness and tingling. Have a good one.